Hi, this is Mardy Chizek with Charism Home Care and Eldercare Services. This is one of the video blogs that we do from our office here in Downers Grove, and I have a guest with me today, Mary Jensen, who is a dental hygienist and does a lot of work with seniors, and seniors are at special risk for a number of reasons. Could be we're not able to brush our teeth anymore. I have arthritis in my hands. I have dementia and I can't remember to brush my teeth. I may have some disease processes. I'm not be able to see my toothbrush and put toothpaste on it, as simple as that. So one of the things that I think that I find is that people don't understand kind of how gum disease and inflammation, which is different than infection, how that can impact on overall body health. And there are some very specific diseases and conditions that are either exacerbated by it or could actually be caused by it.
Right.
Do you want to talk a little bit about that for me?
Well, I'll break it down about the inflammation. If you have bacteria, that sticky plaque on your teeth, and it sits there and it's not removed, those gum tissues will become very red and swollen and inflamed, and they'll bleed easy. Now think about this. The blood that's traveling to that area where there's an infection process going on is the same blood that's traveling to the rest of your body, including your heart. So gum disease has been linked with increased risk for heart disease, for stroke. It's tied in with having a much more difficult time controlling your diabetes if you're diabetic. And it can even lead to aspiration pneumonia. And what is that? That's an inhalation of some foreign body, most likely bacteria from the mouth, into the lungs, sets up shop, and it can lead to a very serious infection, especially for seniors.
Right. Well, and you know, that's why healthcare is delivered as a team.
Absolutely.
Because the person that has dementia will often have swallowing difficulties. And so if I don't have control over my swallowing, I certainly don't have control over my secretions from my mouth.
Absolutely.
And if I haven't been brushing, there are lots of bacteria in my mouth. That bacteria then gets into my lungs, which is a relatively sterile, clean environment, and we get infections, don't we? So what's with the diabetes?
The diabetes, the studies are showing that there is a definite bidirectional link that if you are diabetic and you have gum disease, you will have a much more difficult time controlling that diabetes. And it falls back again to the inflammation of the gums. Your body doesn't know where it's coming from. It doesn't really matter. It's going to respond to that inflammation. And that's why, especially for diabetics, oral hygiene care is extremely important.
Well, and the other side from a nursing perspective is that if you're not brushing your teeth well, there's going to be more bacteria, you're not managing your diabetes well, your blood sugar is high, and those bacteria love all that sugar. So they just grow and grow and grow.
It's just a feast for them then at that point.
So there's really a couple reasons that diabetics get into trouble. Maybe not managing your diabetes well, but maybe managing it well, but having difficulty, and it's just because you're not doing good oral hygiene. Now, we talked a bit about diabetes. Are there other diseases that there's sort of a known link? I know there's some new literature in the cardiovascular literature that maybe plaques in our blood vessels in our heart are secondary to some inflammation in our mouth. Are there other diseases that are problematic?
You can look at stroke. They're actually looking at the blood clots that cause strokes, and what they're finding in that makeup of that blood clot is a bacteria called P. gingivalis, which is the same bacteria that causes gingivitis. So again, the mouth being connected to the body, and to have overall health, you really need to have good oral health. That's the key message.
And you know, I often will work with seniors who've have lost multiple teeth from a variety of reasons. It may be they just don't have good teeth. And you know, one of the issues that I am most concerned about is that aspiration pneumonia, and as we age, we have a lesser ability to fight off infections. And so I have a mouth that's not clean, and for people that have had strokes and have difficulty swallowing, or people that maybe have dementia and have difficulty swallowing, maybe oral care more than twice a day?
Oh, that would be wonderful if that was possible. And I certainly wouldn't tell somebody not to do it more than twice a day, but certainly we know for a fact that increased oral hygiene can decrease the percentage of cases of aspiration pneumonia. There's definitely a cause and effect there.
And what happens from a clinical perspective is you get the pneumonia, or we call it pneumonitis because it's inflammation. It may not be an infection, and then it goes into your bloodstream, and you have what we call sepsis.
Right.
So good oral care can save your life.
Right.
And I want to thank Mary for stopping by.
Thank you, Marty.
You're welcome. And those of you that are watching our blog, thanks again for stopping by. This is Mardy Chizek with Charism Home Care and Elder Care Services. Have a good day. Bye.